let me just give a little sort of overview of research in the U.S. as I understand it, as it's going on, and then maybe we can focus on some of the specific questions. There are three areas of research that regularly appear in neurologic literature, orthopedic literature. One area is basic research, work on motor units, work on anterior horn cells in the context of polio, in the context of other diseases that affect those areas. What weakens them, what can you do to strengthen them, stuff that could overflow and actually benefit in post-polio research as well. Corollary with that is developing animal models of post-polio. The typical animals that we use, mice for instance, don't get polio, and certainly it's hard to get a model of post-polio in an animal that you don't want to wait around for 50 years until it develops post-polio or whatever the timing is. And I believe a couple of researchers back east have actually developed an effective mouse model for post-polio. They've succeeded in giving polio to the mouse and in actually a year later showing the same type of dropout of motor units, axone withdrawal that is seen in humans with post-polio. It'll be an excellent way to study post-polio mechanisms and also a way to have an animal model for drug trials. With the basic research going into the immune mechanisms as it affects the health of recovered nerve cells in post-polio, obviously using these animal models to test out the actual pathophysiology. And that brings us to the next area of research, which is human research into the natural history of post-polio and then setting up clinical trials in post-polio. Mayo Clinic has been doing an enormous amount of natural history research for a number of years. They have some very good publications, which I think have been good guidelines for us. The failed symptomatic trials for pyridostigmine and modafinil, I think, reflect back on the need to design clinical studies using very, very rigidly described groups of polio survivors so that you're not mixing apples and oranges and trying to observe an effect. I think the work that's going on now with IVIG, taking off from the role of the immune system as at least one factor that may be triggering post-polio symptomatology, modifying it with IVIG. This work began in Sweden. I first heard about it in 2000 at Warm Springs, and since then, they've extended their work. The Norwegians are working on it, and Dr. Delakis at the National Institutes of Health has also been working on it as well. And I think that's probably the biggest clinical research breakthrough that's aimed at treatment. Third area is going outside the actual motor unit definition of post-polio, looking at other symptoms that seem to accompany post-polio, including accelerated effects of aging in other areas, developing diabetes, arthritic changes that may be more commonly seen. Rancho Los Amigos, had a large grant and has had a long ongoing study of aging with a disability, which included its polio survivors. I think providing a lot of useful information about the increased health risks that many polio survivors may have, and whether it's related to some underlying general aging mechanism, whether it's just the problems of immobility that seem to accentuate it. I think their research will probably show that. We've done some work here in sleep. And underlying sleep disorders. I know individual groups have looked at speech and swallowing, and there are publications about that. I've got folders of articles on small studies, single patient case descriptions, looking at each of these areas. The effects of vision, I haven't seen any publications on. I think some of the other areas that people have questions about probably deserve to be looked at. But even funding a small clinical trial is you need money. And in the 90s, there was just a drought regarding research funding in the United States for post-polio. It picked up a little bit, but it's still not enough that every worthy project can be funded. But you can start small. You can start with a small study of a dozen people or 20 people who seem to share concerns about vision and explore it with the money that you do have. But I think we will need more money for clinical research, even if the basic researchers seem to have their own sources, because basic research does apply to more than one disease. I think it is known that the polio virus didn't just hit spinal motor neurons, that it also hit central motor neurons. And that there is documentation of change, and there are changes seen on MRI that would correlate with that. So I think it is, a given now for most people dealing with it. Because of that, you would expect to see changes in post-polio syndrome affecting central pathways. I have seen individuals who have developed upper motor neuron findings, which is not something you would expect to see, but with changes in central pathways, which are upper motor neurons, you can see the emergence of brisk reflexes, even upgoing toes, and things that appear to be spasticity related as opposed to motor unit or weakness related. You can find changes in brainstem motor neurons, especially in people that had bulbar polio, where there was documented clinical evidence in the acute syndrome. Affecting weakness in pharyngeal muscles, weakness in accessory muscles of respiration, and other cranial nerve areas. So I think central motor effects have been well seen. Some interest in effects in not voluntary muscle groups on a central basis, but involuntary muscle, autonomic nerve centers in brainstem and brain areas, effects it might have on blood pressure, effects it might have on cardiac function, effects it might have on sleep. And I think there is published evidence to say that these areas have been able to be monitored and seen to be involved as well. Are there cognitive changes in post-polio? People describe brain fatigue. And I think that is a real phenomenon. What the actual hardwiring of it is, I don't know. Because most of the pathways that I just indicated aren't typically involved with concentration and alertness, with the exception of the reticular activating system in the brainstem, which could be at behind the descriptions of brain fatigue and central fatigue. So I think there is growing basic science evidence that that the brain is involved as well as the spinal cord, and that the symptoms in post-polio may include symptoms in those areas as well. Mm-hmm. And that was why I wrote my little grant application to look at signs of inflammation that might be affecting brain structures. Didn't get funded, but I think there is going to be more and more attention paid to that. Certainly, work being done back east, and I forget who the researcher was, with magnetic resonance spectroscopy. I think it was Dr. Trojan was working with that, looking for changes in brain chemicals that would correlate with changes in nerve activity when you can't actually pick up atrophy or nerve cell loss on simple imaging is going to be very important, to follow treatment protocols. A lot of work being done in spinal cord injury, which is an area of tremendous demand. In replacing spinal long tracts. I think a lot of that research is going to be very applicable, whether it's growth factors or stem cells, to polio survivors. So I know that spinal cord injury groups are working very closely with some polio groups, at developing these technologies. But again, it's still very much at the animal research level. It's not being done in people yet.
Years?
5 to 10 years. I would say. There was one pilot study done using a nerve growth factor, insulin-like growth factor. It was being studied in Lou Gehrig's disease, ALS, and the clinician who was running that study, had a group of polio patients that he wanted to see if it would be of help to them at all. Studied it, found, some improved recovery from fatiguing exercise, but no obvious change on muscle biopsies or nerve biopsies. So it was suggestive, but then he didn't have additional funding to really carry on a larger study. So I think there are unplumbed areas that are crying out to have research done in them, where we are at a point where we could be doing clinical trials, and it's just a lack of funding, lack of interest on the part of drug companies. It's an orphan disease in a way because it's a disease that's felt to be dying out.